This inhaler is used to reduce the worsening of asthma and to prevent and treat wheezing and shortness of breath. It is a quick relief product that contains two medications, albuterol and budesonide. Albuterol helps to relax the muscles around the airways, making it easier to breathe, while budesonide works to reduce inflammation in the airways, also making breathing easier. By controlling these symptoms, it can also decrease the time lost from work or school. It's important to use it as directed by your doctor, typically a certain number of puffs at specific times of the day. Be sure to follow your doctor's instructions for the best results. Before using this medication, make sure to read the instructions provided by your pharmacist. Shake the canister well before using and follow the directions for test sprays in the air if it's your first time using it or if you haven't used it for more than a week. It's important to wait at least 1 minute between using different inhalers. Take this medication by mouth every 4 to 6 hours as needed, as directed by your doctor. Avoid increasing the dose or using it more often than prescribed, as it can lead to serious side effects. After each use, ensure to gargle and rinse your mouth with water to prevent dry mouth, hoarseness, and oral yeast infections. The dosage of this medication depends on your medical condition and how you respond to treatment. If you are regularly using a different corticosteroid taken by mouth, do not stop using it unless directed by your doctor to avoid withdrawal symptoms. It's important to always have quick relief inhalers with you and keep track of the number of inhalations you use. Learn from your doctor which inhalers to use every day as controller drugs and which ones to use if your breathing suddenly worsens as quick relief drugs. Make sure to seek medical help if you experience any new or worsening symptoms, and report to your doctor if you do not get better or if you get worse. Some common side effects of Airsupra 90 Mcg, 80 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids may include dry/irritated throat, headache, hoarseness, or coughing. These effects should improve as your body gets used to the medication. If they persist or worsen, be sure to consult your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefits outweigh the potential risks of side effects. It's also worth noting that many people using this medication do not experience serious side effects. However, it's important to monitor your blood pressure regularly, as this medication may raise it. Notify your doctor if you experience any serious side effects, such as white patches in your mouth or on your tongue, weakness, bone pain, nausea/vomiting, increased thirst/urination, vision problems, or signs of infection. In rare cases, Airsupra 90 Mcg, 80 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids can cause severe, sudden worsening of breathing problems or asthma. If you experience sudden wheezing, seek medical help immediately. Additionally, seek immediate medical attention if you experience chest pain or a fast/irregular heartbeat, as these can be signs of very serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, it's important to let your doctor or pharmacist know if you are allergic to albuterol or budesonide, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had current or past infections, bone loss, eye problems, heart problems, high blood pressure, seizures, thyroid problems, diabetes, or liver problems. If you have switched from a corticosteroid taken by mouth to this inhaler within the past 12 months, or if you have been using this product in higher than usual doses for a long time, it may be more difficult for your body to respond to physical stress. Make sure to inform your doctor before any surgery or emergency treatment, or if you get a serious illness or injury. It's important to note that this medication may mask signs of infection and can make you more susceptible to infections or worsen any current infections. Avoid contact with people who have infections that may spread to others, and consult your doctor if you have been exposed to an infection. This medication may also cause dizziness or blurred vision, and alcohol or marijuana can enhance these effects. It's important to avoid driving or using machinery until you can do so safely, and to limit alcoholic beverages. Discuss your marijuana use with your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. Additionally, budesonide passes into breast milk, so it's important to consult your doctor before breastfeeding. Now let's talk about the potential drug interactions of Airsupra 90 Mcg, 80 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids. It's important to be aware that this medication may interact with other drugs and increase your risk of serious side effects. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. And never start, stop, or change the dosage of any medicines without your doctor's approval. One important thing to note is that this product contains albuterol, which is very similar to levolbuterol. So, it's crucial not to use other medications containing albuterol or levolbuterol while using this product. This will help ensure the safety and effectiveness of your treatment. Always consult with your healthcare provider if you have any concerns or questions about potential drug interactions. If you or someone else has taken too much Airsupra 90 Mcg, 80 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids and are experiencing serious symptoms like passing out or difficulty breathing, call emergency services immediately. Otherwise, contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, severe shaking, or seizures. It's important not to share this medication with others. While using this medication, you may need to undergo various medical tests to monitor different factors such as cortisol levels, lung function, eye exams, bone density tests, and blood pressure. It's important to keep all medical and lab appointments and consult your doctor for more details. To avoid substances that can worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold. It's important to learn how to use a peak flow meter, use it daily, and promptly report any worsening breathing problems. It's also important to ask your doctor or pharmacist if you should have a flu shot every year, as the flu virus can worsen breathing problems. In adults, the use of this medication can increase the risk of bone loss, osteoporosis, if used for a long time. It's important to talk with your doctor about your risk and about available treatments for osteoporosis. Lifestyle changes that help promote healthy bones include doing weight-bearing exercise, stopping smoking, limiting alcohol, and eating well-balanced meals that contain adequate calcium and vitamin D. You may also need to take calcium and vitamin D supplements, so it's best to consult your doctor for specific advice. To help prevent osteoporosis later in life, it's important to encourage children to exercise and eat a healthy diet that includes calcium. If you forget to use this medication at the scheduled time, go ahead and use it as soon as you remember. But if it's almost time for your next dose, just wait and take it at the regular time. Don't take extra doses to make up for the missed one. When using the Airsupra inhaler, make sure to store it at room temperature, away from light and moisture. Do not keep it in the bathroom and avoid exposing it to high heat or open flame. Also, keep it out of reach of children and pets. Only remove the inhaler from its original foil package when you are ready to use it. Make sure to discard the product 6 to 12 months after removing it from the original foil pouch, or after using all the doses, as directed on the packaging. When you no longer need the product or it has expired, make sure to properly dispose of it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.